So I wanted to introduce myself. My name is Melissa Tomasic. I work at the Penn State Prevention Research Center as a prevention specialist. For many years, about 20 years, I work with school districts, communities, prevention coalitions to implement high quality evidence-based programs. And really the areas that I work in are substance use prevention, family strengths, social emotional learning, and mental health first aid. I'm also the project director of this particular REACH project that we're, coming from you with this webinar. And it provides support and resources to rural communities and stakeholders in Pennsylvania, Delaware, Maryland, Virginia, and West Virginia to really address substance misuse disorder, mental health disorder prevention, treatment, and recovery. And one of the central deliverables of this project is to deliver monthly live webinars, which each one of us in this region, we take a turn monthly doing these webinars, really to just focus on some needs and some things that our community and stakeholders are looking for. Before I introduced my esteemed colleague, I wanted to do a couple housekeeping. Well, at the end of Glenn's presentation, we are going to have a little bit of a short survey. It really helps us to try and get better in the future, anything that could help us collect information that will help us with this program and these webinars. And then also we have chat and question and answer that feel free at any point in time during this webinar. Please share thoughts or questions. We might be able to get it during the webinar, or we might just wait till after, depending upon how it's going, the presentation's going. So I want to introduce Dr. Glenn Sterner. He is an assistant professor of criminal justice at Penn State University, and he really has been at the forefront of this opioid settlement in Pennsylvania. And he'll be really breaking it down for us, what he knows so far, what he sees in the future, really because we think this is really going to help community members who are in our communities and our stakeholders with substance misuse prevention, harm reduction, and treatment. So I will turn it over to Dr. Sterner.
Thanks so much, Melissa. I'm really happy to be here. So as Melissa has mentioned, I'm an assistant professor of criminal justice. I'm really attached to a couple of really important parts of the institution, the Criminal Justice Research Center and our consortium on substance use and addiction. These are university system-wide initiatives to really take a look at critical issues in our communities, both from a community safety perspective, but also regarding substance use and addiction all across Pennsylvania. And so the work that we've been talking about here, specifically around the settlement funding, is really a function of those two specific entities. And they've been a huge support in the work that we do at Penn State and in conjunction with our state and federal partners in this work. And so this presentation, this webinar, is all about understanding the opioid settlement funding and what it really means for community-based work. And I'm so glad to hear that we have folks from across the region, across different states. And so what we're going to do today is we're going to talk a little bit about what the settlement process looked like. Like, how did we get here today? And what does it mean? What are these opioid settlements? And what might you be hearing about along the way? I'm going to do an overview of what's going on in every single state, and I'll show you some opportunities to continue to be updated around what's going on in your state around the settlement funds that are reaching you and potentially your communities. Then providing some resources for you as you're starting to think about, so how do I conceptualize using these funds in ways that will hopefully maximize their impact and hopefully, again, help the people that you're working with every day. And then finally, we're going to talk a little bit about some really important implications for community-based work that you're going to want to make sure that you keep on the top of your head as you go into these conversations around these potential uses. But along the way, if you have questions, Melissa mentioned there's opportunities to ask questions in the Q&A box. It looks like Cynthia just put up there, and thank you for that. It looks like the webinar chat function is disabled, but feel free to just throw questions in the Q&A function. That's an easy way for me to see things. I'm going to keep that up along the way, so feel free, and we'll just go from there. So feel free to interrupt, and we'll go hopefully really smoothly, and then we'll leave a few minutes at the end of the presentation just for some general conversation and questions that you might have. So with that, what are these things? What are we talking about with regards to the opioid settlements? So we know that the opioid crisis currently is more than just opioids, right? But we do know that the foundation of all of this lies within the faults, frankly, of the distributors, the manufacturers of prescription opioid painkillers across the entire country. And we know that this is the case because of, frankly, these lawsuits that have really brought to light some of the nefarious work that they have done. And we also know this, frankly, because our friends, our family members, our community members, our neighbors are really dealing with this issue and have been dealing with this issue for many, many years. And so this was a way for us to really think about, knowing that these origins are within these companies, and that this really helped to fuel what's going on with beyond what we consider just the opioid crisis. We now consider this more along the lines of a substance use crisis or an overdose crisis, because it's burgeoned beyond just opioids within our communities all across the country, and frankly within our region and within our states. But rather than thinking about making up for past damages, this, important to note, is that it's for abatement of future uses. And so as these settlements came to fruition, these funds that I'm going to be talking to you about are not meant to make up for the losses, right? Nothing that we can do could potentially ever make up for those folks that we have lost, our loved ones, our friends, our family members, our neighbors. But what we're hoping to do is find ways to make sure that we're preventing those overdoses, preventing those deaths, and preventing those substance use issues within our communities now and in the future. I'll also say this: these settlements, these are not a magic bullet. These are not going to solve all of our problems. This is not enough money to make up for what we need to do in every single one of our communities to address substance use issues. We know that. So with those caveats, I give you the fact that we have a large amount of money that is going to be going to nearly every state and nearly every community and county across the entire country. And I see this as a huge opportunity. This is the first time in the opioid crisis that we have had the opportunity to essentially pause, ask questions around what is it that we've been doing, where do we currently stand, and really, where do we want to go into the future? And every single state is doing this. I see this as just a huge opportunity that cannot be missed as we start to think about the ways that we want to address substance use issues in our communities across our states and across the entire country. So I really hope that you see this as much of an opportunity as I do, and as much as an opportunity that I think that many of the state leaders and local community leaders have really started to take on within the plans that they have developed. So with that said, this is kind of an overview of where we got from. So in the beginning, and even as early as roughly in the 2000s, we had some small individual settlements that lawsuits against these companies, trying to hold them accountable for the role that they were playing in the opioid crisis. And these were percolating here and there, but for the most part, these individual lawsuits were having major roadblocks. And so what happened in roughly 2017 is that these individual lawsuits, these state attorneys general and several other folks, helped to come together into what's called an MDL. So you typically hear things like class action lawsuits. This is similar to that. It's multi-district litigation. And they pushed forward these settlement processes. And so states had to sign on and say, hey, look, I want to be part of this group. Some states did not, and some locations didn't. And so, for example, Oklahoma continued in their lawsuit with J&J, and they settled in 2019. And really, that was the first large major lawsuit that we saw with some of these companies. But beyond that Oklahoma experience, all through that time, this large group of states and state attorneys general. It's a weird phrase to say, but they were working behind the scenes to really levy these lawsuits according to the needs of the states that they represented. And so the first, we consider these waves of lawsuits, right? And the first wave is really with Johnson & Johnson or Janssen, and then 3 distributors, McKesson, Cardinal, and AmerisourceBergen. And that's probably the lawsuit you're probably hearing the most about. That's the one that is the largest so far. It's $26 billion that will be spread across those states over the course of roughly the next 18 years. And there's a whole schedule attached to this. Important to note is that most of these funds are going to start with a large balloon in the front end. So you're going to get a bigger allocation in the beginning, and then eventually it's going to taper off. So it's not just like large sum, and then you're going to fall off the cliff at the end of that 18 years. And I think that is really, frankly, a good way to do this, because we're front loading the information, front loading the distribution, and then we're finding ways to hopefully sustain those needs over time. And again, hopefully, some of these needs will eventually be abated by by the use of these funds. So in 2021, in 2020 through 2022, the individual states within that first settlement work through that process of signing on, and they had to work with their local communities. Local communities had to sign on to this as well. So they had to say, state so-and-so, we agree with this settlement, and we're going to participate as well. And so within each of these states, they had to meet different thresholds. This is a really different structure than most of the other types of litigation we've seen. This means that community input was here from the very beginning. Individual, whether that's a county commissioner or sometimes your state your city council members, those are the folks that had to say, yes, we believe in this. We think this is a good option for our location, and we think that this is going to help us into the future. So that level of funding that each individual state receives, frankly, depended upon how many local stakeholders they were able to engage and sign on to this. Because the way that this works is that once this settlement is reached, they are foregoing the opportunity for future litigation, essentially. And so that was in 2022. There's a small side group that J&J and those same distributors also created a separate agreement specifically for tribal communities and tribal locations across the country. And that one was a $440 million settlement. That is completely separate from all this. So they have that to essentially use according to their needs within their communities as well. We're now into this section where we're considering what's called wave 2. So wave 1 is done. It's settled. It's getting out to counties. It's getting out to communities. It's getting out to states. Wave 2 is still in the process of being finalized. And this is with several pharmacies. You probably have heard about this, that they're settling with CVS, Walgreens, Walmart, some of the manufacturers, Teva, for example. So those are this second wave is going to be a little over 20 billion or so. This final number may change. It's again still in that process. And then in the future, we're planning that there will be continued settlements. So for example, the Purdue settlement still is not finalized. There's Mallinckrodt, again, still not finalized. And there's a couple of others that are still waiting to be worked through the court system. But the way that I'm going to talk to you today is that from everything from wave 1 on forward is the way that these settlement funds will be distributed across the entire country, and then most likely within each of our states. It is up to our states to decide how they're going to distribute that, but for the most part, they're probably going to continue with the same structure that they had before. So with that, the best place for you to keep track of all this is this National Opioid Settlement website. And here's a QR code and the link here. This is the official information around all of these settlements. It gives you a good understanding. And I'll particularly point out the state participation chart and documents. This gives you direct information about what's going on for your state in an official capacity. But I'll say it's a lot of legalese. And so if you want something that's a little bit more approachable, I really recommend this website. It's called the opioidsettlementtracker.com website. It's put together by this fantastic attorney, and she also has been pulling in other content. Stuff that's really going to be important for you specifically is this section that is called the State Level Guides for Community Advocates on Opioid Settlements. This was put together by her, as well as Vital Strategies, which is an organization that's really trying to think about this in a really important way. This meaning substance use. And here's just an example of what you can expect. And every single state, including DC, has one of these sheets. And it breaks down this information: key takeaways, total funds and allocation, mechanism, decision-making processes, engagement in the process, how you can be engaged in that process, tracking those funds and resources. So highly recommend that you take a look at these PDF information sheets for your states. And I believe that the plan is for these to continuously be updated. On this website, there's also a breakdown of all this information as well. But what can these funds be used for? Well, there's this whole thing called Exhibit E. It's a really boring looking document, but what it does is it gives you a really good list specifically of what these funds can be used for. As I mentioned before, this is about abatement for the future. This isn't meant to be to make up for past losses. And so because of that, the whole goal of this is to find ways to utilize these funds in a proactive approach, from across treatment to prevention to, in some cases, criminal justice experiences, recovery support services, and a whole host of other opportunities for you to meet these needs, based on this what's called Exhibit E. And this gives you a list of remediation uses. Now there's two schedules. Schedule A is what's called the core strategies. These are like the ones that they are preferring, but it doesn't mean that you have to use those. It depends on your state, though, I will say. And then there's also Schedule B, which is a really full listing of what's going on across the opportunities to be able to use these. When I get to West Virginia, I will give a preface that this is different for your state specifically. So this is only applicable for every other state except for West Virginia. And I'll explain that as far as why that is. But it's got everything here that you will need to know, including things like harm reduction strategies, et cetera, that are approved. And I was part of the group that helped to develop the strategy for how it is that we are going to distribute these funds across the Commonwealth of Pennsylvania. And we've also, in this article, I'm putting this up here for you with a QR code as well, because it really helps you to understand the context of the opioid settlements from a national perspective, all the way down to the case study of Pennsylvania. So it's a little bit different state by state, but it kind of gives you a good understanding of how all of this happened. And the way that the funds were broken up across states is in this first section. And so it was based on this formula that was put together that included accounting for overdose deaths, the amount of opioids dispensed within those states, the prevalence of pain reliever use disorder, and population. And so that same replication formula is how these current funds, these current settlements, are going to be distributed across every state, and that's what we're going to be likely using for every settlement into the future attached to opioids. So what I want to do now is switch into what's going on state by state. So I'm going to talk about Pennsylvania first because I know the most about Pennsylvania, and I've been the most involved with how this process has worked. And so what I'm talking about here is essentially the baseline of what we're going to be using. So in Pennsylvania, we're going to start with this wave one with Janssen, AmerisourceBergen, Cardinal Health, and McKesson, that settlement. And every single settlement for us into the future will be used in this same format, will be used in the same way. And so because of that set large amount of funding, we're set to receive about $1.07 billion from this first wave across these next 18 years. And that's a lot of money. And in that process of negotiation within the state, they decided that instead of having that live at the legislative level, that we wanted to create something that was perhaps a little bit separate. And so they created what's called the Pennsylvania Opioid Abatement and Misuse and Addiction Abatement Trust. It's a very long title, and I'll show you their website in just a little bit. But that trust is overseen by 13 trustees, and they are appointed by various bodies across the Commonwealth of Pennsylvania, including the governor's office all the way down to county commissioners. But the goal of this is not to do anything other than be essentially a pass-through and to make sure that the funds are being used according to Schedule Exhibit E. And so within that authority, they have just basically oversight, which is an interesting perspective for Pennsylvania, because most of this oversight now resides out into where these funds are going. So our funds are going to be broken up between the state of Pennsylvania, Pennsylvania counties, and initial litigating entities. These are counties and cities and other organizations that initially started to levy some of these lawsuits across Pennsylvania for with these counties and with these with these companies now and into the future. And so because of that cost that they expended for legal fees, et cetera, they're getting a specific allocation. Deb Rudy, I see that you have your hand raised. Do you have a question quick?
I allowed you to talk if you wanted to talk, or was that an accident?
Hey, can you hear me?
Yeah, I can hear you.
Yes,
Wonderful.
we can.
Thank you.
Good work.
Appreciate your assistance.
Of
Do you know
course.
how much the litigating entities did receive, what percentage they did?
Yeah, absolutely. That you gave me the best transition. So within these three groups, the litigating sub-entities receives about 15%. So of that total allocation, the state of Pennsylvania also receives 15%, and that's overseen by the state legislature. And in Pennsylvania counties, that's the bulk of it. 70% of the funds goes directly to the counties, but those initial litigating entities are also at the local level. So roughly 85% of all of Pennsylvania's monies goes directly to the counties and communities, and they're overseen by county commissioners or these specific entities that have been given these funds. And so what's also important here is that the state of Pennsylvania, they allocated most of their funds to the Department of Drug and Alcohol Programs, which is then sending that money back out into local communities. So almost all of our funds in Pennsylvania are going to be going out to local communities. And so that's important for people to remember. Here's just this broken down in something that's a little bit more accessible. So you see that, again, this is overseen by Misuse, Addiction, and Abatement Trust. And then that's, where they're going to control the funds, but the oversight is really at the local level. And so if you want to know how we distributed that money across Pennsylvania, this was the formula. I actually helped to develop this formula for Pennsylvania. And so most of it is based on these four metrics, but the important stuff is here. The Pennsylvania Opioid Misuse and Addiction Abatement Trust. This is their website for those who are in Pennsylvania. It's a little scant right now. There's not a lot of information there, but I am working with a team here at Penn State, and we're working in conjunction with them. We'll actually be helping to bolster some of this content over the next several months in order to, again, make it a little bit more usable. If you have questions about use or uses of these funds, you can submit a question right here, and they will answer that, and they're going to start to aggregate those answers for, frankly, anybody who wants information. So that was Pennsylvania. Next up is Delaware. I'm going to go alphabetically from here on out. So Delaware is set to receive roughly about $187 million. So quite a lot smaller. And roughly that's about $100 million from Wave 1. And so far, about $87 million from Wave 2 is kind of the projection here. All of this funding, though, is going to be allocated to the state fund. It's called the Prescription Opioid Settlement Fund. And this is overseen by the Behavioral Health Consortium. They're going to distribute that funding based on the recommendations of what's called the Prescription Opioid Settlement Distribution Commission, POSDC. And here's their website for those of you who want to learn a little bit more about this. It looks like the way that they're going to be handling most of these funds is through a granting mechanism. So for local locations, you're going to have to probably interface with this commission and with behavioral health at the state level in Delaware. But here's the location where you can actually start to apply for those grants. They've started to already administer the funds. I believe their first grant was out to some treatment providers across the state of Delaware. So they're already starting to get these funds out there. So make sure that you're connecting with them. For the I included DC here just because people may have intrigue or want to potentially work in there or be connected with them. Their total award is a little over 78 million. They're going to be receiving some funds from Purdue in conjunction with Wave 1. And most of their funds are actually going to this abatement fund at the district level. And so this is all overseen by the Department of Behavioral Health. And so they're working through this more along the lines of like a district allocation process. So they're providing recommendations on its uses to the mayor and the DC council. So it's much of it is built right into the structure of the district government. And here's the website. There's not a lot of information out there about it just thus far, but this is the place that folks are going to want to make sure that they continue to monitor, because this is the Department of Behavioral Health's website. More information is going to come up on this about the settlement funds there. For Maryland, you're complicated. You're going to be getting about $395 million from Wave 1. And then also you're going to get about $132 million from Purdue projected as well. But the way that this is distributed is that 15% of it's going to go to the state. That's going to be overseen by the governor's office as well as the legislature. 25% of it is going to be distributed out to localities. So a good amount here is still going to go out to local communities, but important that those are the 25% that have signed on during the lawsuit. And then 60% of it is going to the state fund called the Opioid Restitution Fund. And it's within a sub-account known as the Targeted Abatement Subfund. And that's going to be used to provide targeted abatement grants to subdivisions of the state. So what does that mean? So the oversight of this fund is within the Opioid Restitution Fund Advisory Council, and I will provide you their website just right after this. And so 25% of that fund, so of that 60%, 25% of it is basically like for projects determined by the Secretary of Health or the Opioid Operational Command Center, whereas the other 75% is going out to non-competitive grants to subdivisions. So your local communities can apply. They just basically have to come up with a proof that they're going to have the infrastructure to take care of these. They have a plan for the use of these funds, and it's within the approved uses within Exhibit E. And so if you're interested in learning a little bit more about that, here's the website for the Opioid Restitution Fund Advisory Council. This is where you're going to find, again, where you're going to be able to provide access to the grants and working with your local communities to do so. Within Virginia, you're going to be receiving roughly about $670 million. Again, $530 million from Wave 1, $60 million from Walmart, and roughly about $80 million from Purdue. You're seeing that some counties and some states and some locations they vary based on who the lawsuits that they have signed on for. And so that's what this is trying to capture here. So this is still, like I said, very much in flux. But for now, we at least know that Wave 1 is set. The others may fluctuate here and there. But roughly 15% is going to go to the state. 30% is going to go out to subdivisions. These are counties, as well as potentially municipalities and those types of things across the Commonwealth. And then 55% of that fund is going to go to this Virginia Opioid Abatement Fund. And this is going to be administered by the Virginia Opioid Abatement Authority. 15% of that, 55% is going to go to state agencies to work on opioid abatement as well as other substance use issues. 15% to political subdivisions, according to Exhibit A, and then the 35%, and I'll talk the subdivisions within Exhibit A. Those are the specific locations within Virginia that have a breakdown of the percentages of how it's going to be distributed across the Commonwealth of Virginia. And so that's basically just saying, here's your allocation. And then the 35% to projects with 2 or more cities or counties, and then 35% is out to unrestricted use. Again, this is a little bit more complicated and a little bit more complex, and so it's really important that you stay up to date on this, and this is the best way to do so. So again, much of these funds, the majority of these funds are going to be held here. And so you're going to want to understand their priorities, understand how it is that you can get access to this, but also work with your local county and city governments in order to apply for these funds in ways that make the most sense for your communities. I mentioned West Virginia is different. And that's because West Virginia is not part of those states that signed on to that MDL. So we have all these, roughly 46 states that have signed on to that really big group This is one of the states that has not. And so they have decided that they are going to go it alone and levy their own lawsuits. And so because of that, they're still in the process of settling some of these things. But projected for, today, as far as we know, that West Virginia is going to receive about $500 million across all of these various lawsuits with these various companies. So about $511.5 million to date. This is not settled, and this is just so you're aware, it's not currently available for communities to use just quite yet, as far as I understand. So roughly about 3% of these funds are going to go to the state. 24.5% are going to go straight to the local communities, and most likely that's going to be county governments. And then 72.5% is going to be within this West Virginia First Foundation, and they're going to oversee the use of these funds. This is currently still in development, and so there is no information about that, but I recommend that you continue to stay up to date about that through the West Virginia government websites. I mentioned before within Exhibit E that there's a little bit of a different use strategy for West Virginia. They have what's called Exhibit A. So we have really creative names for these things. So Exhibit A for West Virginia is what it looks very similar to Exhibit E for the national MDL, but it's a little bit different in that it doesn't allow for syringe service exchange. So for those who are looking to implement those types of strategies in your communities, that's not allowed with these funds in West Virginia. In addition, there's a bit more of an opportunity here for law enforcement. And the other thing here to recognize is that you can use some of these funds to make up for past expenditures, which is not necessarily the case in the MDLs. So the way that we're going to see these funds be used in West Virginia is likely going to be a little bit different than what we're going to see in the other states. So it will be important for you to recognize what can be spent, what these funds can be spent on, and how do you get access to them over time. So as you're thinking about the use of these funds, what we're really hoping for is that we think about this concept of evidence-based strategies. And so what we're trying to do is really get to this green side of this figure, the effective, those that are research-based, those that are evidence-based, that we're really confident that we're going to be able to use these funds in ways that will help to address substance use related issues in our communities. We know that we're always trying to make sure that we're striving for those practices. I'll also say that evidence-based criteria, that's a really high bar to make. And so there's also opportunity here for us to maybe try out some things that maybe are research informed or are based on previous practices, or maybe a modification that we hope could potentially have possible impacts. And so the importance here is to recognize that we can allow for a little bit more flexibility than in other cases with the use of, say, federal funds or state funds or SOAR funds, or even, for example, SAMHSA funds that we're talking about from the grants that were grantees on this call and such. But important is that we're trying to avoid those that we know that are harmful, that are ineffective, and that are, frankly are discouraged approaches. And so that's why it's important for us to really be thinking into that promising approaches and beyond range when we start to look at what it is that we could be utilizing these funds for. Because again, we want to make sure that these funds are being maximized to their utmost potential, and that we're not wasting this opportunity to really reflect upon how it is that we can move into the future and really address substance use issues across frankly, all of our communities across not just our states here, but across the country. And so as you're starting to think about this, there's lots of resources for you to bring to both the state level all the way down to the community level. So Johns Hopkins has put out this really great opportunity for us to really consider the ways that we can think about maximizing the use of these funds. And they have developed 5 guiding principles. And this is more along the lines of how it is that we could make sure that we are maximizing the opportunity here to save lives. And that's what they're really thinking about within these 5 guiding principles. I'll let you visit this website, but again, these guiding principles are more along the lines of like a conceptual framework. So like, as we're starting to think through this, how is it that we can potentially maximize these funds? And this is a way for us to really start to break down those 5, those uses of those funds from more of a larger perspective. But if you're looking for potential actual strategies, I'll indicate that Brandeis University has a really great resource. It's called the Brandeis Opioid Resource Connector. And what it does is it helps you work through your interests and your needs within your communities, and then identifying potential interventions that you could implement within your community to address your community's needs. Highly recommend this resource as you're looking at maybe things that you haven't used before, or interventions that may be new to your community. You're looking for a little bit more creativity. The hope here is that these types of experiences can be, again, informed by data, science, and also evaluation along the way. And the other resource that I'm going to just share with you is that I consider North Carolina to be perhaps the, if not one of the leaders within the entire country, as they're starting to think about how it is that they can maximize the use of their funds. So they have a whole set of resources here. And so while some of these may seem like North Carolina specific, there are certainly opportunities for you to implement some of these strategies in ways that make the most sense for you. Whether that is an actual intervention or whether that's a convening experience, there's lots of resources here for you to start thinking about that. And then what you'll need to consider is, how do you get access to the data in order to make sure that you can assess what's going on in your communities the most effective way possible. And there's lots of opportunities through those previous resources that I've mentioned before for your individual states. But now that we know what these opioid settlement funds are, roughly how they're going to be controlled in our states, so what, right? Like, so what does this mean for us, for those of us who are out here doing community-based work? And frankly, it's really important that you do this. You have to be clear on state structures for distribution and oversight of the funding. As I clearly demonstrated, it depends on state to state to state. There's no state that looks exactly alike, and there are different committees and structures and opportunities to get access to these funds. However, I will note, in most of our states, much of those funds are going to be controlled by counties or city level administrators. Those are where you're going to need to focus a lot of your efforts. It makes it more complicated, right? It would be really nice if you just could go to, say, state legislature, I know that these funds are going to X, Y, or Z, and we're going to apply for these grants through your different department, but that's not always going to be the case. It makes it more complicated because you have to develop relationships. You can capitalize on existing relationships, but you're really going to have to think about how much funds are available to me if I'm working within this very specific county or within this very specific community. And the only way that you're going to be able to do that is by understanding how that structure works in your state. And that's why you need to make sure that you're connecting with those local stakeholders, right? You have to be the advocate here. You all know the best ways to use these funds because you understand the science. You're steeped in the community. You understand what's going on. You hopefully have a really good understanding of some of the data so that you can then say to your local administrators, this is where we need to focus our efforts because this is the key indicator that we know that we need to address. And if you're not doing that, this is a great time to do so. And so as you're doing this, making sure that you're advocating for that local approach and for those efforts to intervene to make the most of these funds. And I'll say this, while our local administrators are really great people and you're going to have to work with them, they are not experts in our field, right? And you are the experts. And so they're likely, and I've spoken with many of them already, they're already looking for suggestions on how to use these funds in ways that make sense for communities to address substance use issues. They're looking for advice. And so you can be those people who can get their ear and hopefully provide some of those needed advice tips for them on how to spend these funds most effectively. You got to examine Exhibit E or Exhibit A for West Virginia, but you need to understand exactly how you can use these funds. Exhibit E is like I said, it's a really boring document, and I'm hoping that we're going to be producing some other stuff that will make it look nicer so that people can hopefully make it more accessible. But for now, important here for Exhibit E is that you can read it and you can say, I think that this could potentially work and that this is an intervention that fits within it. You need to make sure that you're connecting with your state governing body, because they have to interpret the potential uses. So remember when I was talking about who is controlling the funds in every single state? They're going to be the ones that interpret whether or not Exhibit E fits the various interventions that people are proposing. And so that might look differently from state to state to state. It's not going to widely vary, right? Like we're not going to see huge variation, most likely, but there might be. And so you want to make sure that you're really clear with these various states on how it is that they're interpreting Exhibit E before you say, I'm going to propose this. Because you don't want to propose something that's not going to work there. You also know many of the most evidence-based practices within these categories within the Exhibit E. And so understanding the potential uses there, incredibly important. Number 4, I can't say this, I'm probably preaching to the choir here, but I know that I must say it over and over and over, that we have to advocate for evidence-based practice. We want to make sure that we're maximizing the impact of these funds. The way to do so is to use interventions that we know have the highest likelihood of success in our communities, given everything that we know. Are we going to likely have some pitfalls? Sure. But if we know that we can potentially replicate these things, if we can develop evidence base by utilizing research-informed practices and continuing to monitor those implementation as well as all the way into evaluation, that's how we're going to continue to grow this field and continue to make sure that we are having the biggest potential impact on those who need it the most. And that's leading me directly into this, developing an evaluation plan. So whether that is for your specific intervention that you are hoping to implement with these funds in your community, or if you're looking to think about this from a state-based perspective or across community perspective, developing an evaluation plan is incredibly important. We want to make sure that as we're maybe trying out new things, like I was saying before, or as we're implementing these interventions in our communities, that we are monitoring their fidelity, right? So we are making sure that they are implemented according to their plans. But if we're learning about potential needs for change, if we're understanding that maybe some cultural competency needs to be integrated into this intervention, that's great. And that's great important knowledge that we can share across the field. And so let's make sure that we're thinking through how it is that we can evaluate and then help other people understand the impacts of our interventions, as well as the way that we're using these funds across the state. In Pennsylvania, we've already started this conversation. We've developed this initiative called the Elevate Pennsylvania Initiative, and we're already starting our process of understanding how it is that we can evaluate the uses of these funds across the entire Commonwealth of Pennsylvania. And if you're interested in doing so in your state, I am happy to be somebody that can be a resource for you, because we have developed a preliminary model and we're about to launch this project in concert with our Opioid Abatement Trust, it's called the County Commissioners Association of Pennsylvania, CCAP, because most of our folks are within the county commissioners realm. The Pennsylvania PACTA, Pennsylvania Coalition of, County and Drug Administrators Association, as well as 2 other higher ed institutions, University of Pittsburgh and Temple University. And so we're all banding together to find ways to make sure that we can maximize the use of these funds and make sure that we don't waste them over time. And so if you're interested in that, happy to chat with you about those things. So with that, I'm going to provide an opportunity here for us to have a few questions, talk about the things that are on your mind, to clear up some confusion, because I know that this is a lot of like legal, administrative, governmental bureaucracy that you're probably trying to navigate in order to make sure that you can use these funds in your communities. So happy to answer questions now.
Thank you so much, Glenn. That was really helpful. That was great. So anybody who has any questions, they could either raise their hand and I could unmute them, or you could put something in the question and answer. I thought that was really fascinating, the Exhibit E of really all of the things that are eligible to be used for funding, because I feel like a lot of us who are in the community doing community work, we feel like we have programs or activities or strategies that will be eligible, evidence-based programs. But like, how do we go about, like, where do we start? Do we kind of look at Exhibit E first and then start talking to our local drug and alcohol kind of thing? I mean, just thinking about that, what do you suggest is the best way to do that?
Sure. I think that the best way to start is asking the question of what your community needs, right? And so let's make sure that the suggestions and the uses really start from the community perspective rather than us applying Exhibit E to our community, right? What's really great about this is that if we feel like we're missing something in the work that we're already doing, this has a lot of flexibility with regards to the use of those funds that we may not have had the opportunity to think about before. So for example, in Pennsylvania, we can use this for capital work. So you can actually build buildings for treatment, for example, where most of the other funds that we get, say from like a federal level or even a state level, it's about implementing those programs, right? And so this can help us to develop this infrastructure in order to implement, and you can combine uses of funds. And that's a really important strategy to take. So what are the funds that you already have access to? How can you match what's going on in your community according to your needs? And can then the opioid settlement funds potentially fill that gap that you haven't had before? And so as you're starting to think about the use of these funds, that's a really great strategy to have.
That's great. Thank you. And I also put the link to the evaluation in the chat. So we really appreciate you guys taking the time, and it'll only take a minute or two to be able to complete that. But does anybody else have any other questions that they would, oh, okay, here we go. How much,
Yeah.
oh, have you seen much use of the funds with faith-based recovery work?
So to be fair, I will admit that there's not a lot of these funds that are actually being used so far. I've only seen a handful of interventions actually being implemented with the use of these funds. And in those cases, they're in the very preliminary stages. And so in some cases, we've seen it go to treatment. In some cases, we've seen it go to innovative programs for, and I believe including prevention. So it just really spans the gamut. So with regards to your question around faith-based recovery work, that's a question that I don't know the answer to, because I haven't specifically seen that, but I don't think that that's a restriction, that it cannot be, that faith-based work is excluded from the uses of these funds. And you'll have to make sure that you're connecting with your individual state to make sure that that is an eligible use of these funds according to Exhibit E.
So Glenn, even though the money is coming through now, not much, we're not like too late to try and garner some of those funds. Like we still have an opportunity to like work with our communities to be able to do that.
Absolutely. So if you think about it so far, so for example, in Pennsylvania, we've only seen 2 checks go out to communities so far. And that was in December, and I believe December and October. So most of these funds are just now getting into the hands of people who can actually implement the use of these funds. And they're still deciding how it is that they're going to use it. We're also talking about 18 years. While we're going to have much of the bulk of those funds in the beginning, there's going to be opportunity to influence how those funds are used over time. So you are absolutely not too late. You should be connecting with your local, like I said, your local stakeholders are the most likely opportunity for you to get access to some of these funds, except in Delaware, it's a little bit different. But that's where you're going to want to connect with folks, is to make sure that you have those connections to those local stakeholders, those county administrators, those county council members, the city council members, wherever that oversight is lying within your community, that's where you need to go.
Great. So it's really beating the bushes to try and find the people to talk to about what you're doing and how you can collaborate.
Exactly. And one of the other, and I should have shared this with you all as well, but in some in the Appalachian states, it's not a universal tracker, but there's another tracker that's out there that is helping us to understand how individual counties are using these funds. In Pennsylvania, where Penn State, Temple, and University of Pittsburgh will be aggregating all that information so that people understand how that's happening in every single county in the Commonwealth. That's not necessarily the case in all the rest of the states. So it's important for you to know that information. Sometimes it's available on your county website. Sometimes you have to go all the way up to the state level website, but there is opportunity for you to start to really dig into this just a little bit more.
Oh, that's great. That's good. Wonderful. Okay, so here we have another question. Is there a provision that allows for disclosure of the recipients of funds?
Yes, and so in each of the individual state, again, it depends on your individual state on how they're planning to do this. But for example, in Missouri, I'm using a state that's outside of our catchment area here, but it's because they've already set this up in a really great way, and I'm hoping that more states replicate what they're doing. So Missouri has set up where you go to their website, you can click on an individual county. It will show you specifically what each individual county is spending it on and who they gave the money to. And so if that's something that you're highly interested in, Carolyn, I highly recommend that you say, hey, state so-and-so, it's really important that we have this level of transparency. Also on that opioid settlementtracker.com website that I showed you, there's a whole section there that talks about how can I understand who these funds are going to in these communities. And there, I believe most of those fact sheets that I indicated as well that they've created have links directly to find out where it is that you can go and understand that information.
Okay, great. And then we have another question. Could you share a little bit more about the evaluation of the program or the funding, how it's being how it's being used across Pennsylvania?
Yeah, happy to. Karen, I'm leading this project.
That's another webinar, right?
It is another webinar, and happy to come back and talk to you. So we've developed this project. Thanks again to the Social Science Research Institute at Penn State for really giving us some seed funding to be able to have this conversation across the institution and in conjunction with our colleagues at University of Pittsburgh and now Temple University. But our plan is this. We are planning to have essentially three large components to this evaluation. One is that Penn State is coordinating the reporting that is required of every single entity that receives funds across Pennsylvania. So if you spend $1 of these settlement funds, you have to tell someone, and that someone is going to be us. And then we're going to be providing those reports to the trust. And so because of that information, we know exactly how all of these funds are being spent across the Commonwealth of Pennsylvania, which is a really great start. But that's only just part of it. And so what we're hoping is that from that information, we'll be able to understand the interventions that are being implemented in every single county, and then find ways to develop a sampling structure that will allow us to understand what is working better and maybe what is not working as well, and how it is that we can help to elevate those that are working as well, and as well as provide some technical assistance through a continuous quality improvement type model to those that might need a little bit more help. And so that's one component, is that local evaluation section of the uses of these funds. The second part is developing statewide data infrastructure so that we can do more rapid reporting of key indicators of public health and safety, including overdose deaths, substance use patterns within youth populations, emergency room admissions, a whole host of indicators that we're going to aggregate into this data warehouse that individuals who are interested in the local community, we can create reports for them through, again, that CQI component, but also so that we can ask questions across the Commonwealth, what is working and what isn't working, and what are the impacts of potentially public health over time. The third component is this important, and we see this as perhaps one of the most important parts, is connection back with the community. So again, developing ways that we can understand what communities need, developing relationships with them over time. And that way that CQI component can be measured, and we can also make sure that it meets the needs of local communities, because we see this as an opportunity to develop these relationships over the course of these next 18 years. And then we also have our component that is really specifically focusing in on that connection between the universities and the trust, and developing that relationship so that we have that open understanding of how it is that we can make sure that, again, we can collect those reporting data, help the trust understand how these funds are being used across Pennsylvania. And so we have a whole lovely plan for finding ways to make sure that we can then monitor this over time, both from an individual intervention perspective, but across county, cross state opportunity. And again, we're happy to share this. We're in the process of finalizing that model so that we can publish it and share it with other counties, other states across the country. So that's in a nutshell what that is. Karen, if you want to know more, happy to do so.
Well, that's great. I have to say that, that having that, in place is really reassuring, that the money will be used, because it's a lot of money, a ton of money, and to be used along the whole continuum of care between prevention, intervention, treatment, recovery. It's just really nice to be able to look at that and, be confident that it's going to go to the right places. So that's great. And then we have one last question that I don't know if you could squeeze this in, to compare, contrast a little bit of the similarities or differences with how the tobacco funds were administered or used.
Yeah, happy to. So this whole settlement, so I was in the room when people were making these negotiations around how it is that we're going to use these funds, and the tobacco settlement loomed large over those discussions. This is why we see so much local control, because folks were so upset that these legislators were able to allocate these funds according to what they needed from the tobacco funds. Those experiences, the phrase that I continuously hear is, it was used for potholes, and in some states, unfortunately, it was. In this case, much of the control is at the local level of these funds, and there is a very specific list, that Exhibit E/A, of approved abatement funds that these funds must be used for in our communities, and there is that structure to make sure that they are being used for. And if they don't use the funds appropriately, they can then cut off those funds into the future to make sure that they don't continue to misuse these funds over time. And so there is an accountability factor that is baked right into this, that again, perhaps wasn't within the tobacco fund. So I like to think of this as an opportunity to learn what some of our mistakes were with those tobacco settlement funds, and now find ways to make sure that we're going to hopefully maximize their uses into the future with these funds. It does make it more complicated. Local control means that you have individual localities with different politics making decisions around how to use these funds, rather than one state legislature doing so. So it's complicated. However, I think it is a greater opportunity for us to make a market impact.
That's great. We actually had one more question in, and I also just wanted to say that the evaluation is in the chat, so please fill that out. But Kim had one more question, a great question. Is there a requirement for each of these states, the fund holders, to hold their own information sessions with their communities?
Kim, I think this is a great idea. Unfortunately, it is not the case.
Oh,
so
yeah.
It depends on state to state. I believe that is the function of, so in Maryland, there's that opportunity to band together with another city or county or what have you to work on a project together. You then show like you're doing this, you're connecting with your local stakeholders, and then you can get access to more funds, right? So there's ways that they're incentivizing some of these things. And in Virginia, I think part of that process of getting access to these funds is that you have to show that you have worked and had some conversations at the local level and have the infrastructure in order to implement these funds within your locality. And so there is some of that in there. It is not necessarily a requirement of every state, and it's not a requirement for all of the different types of funds. So for example, in Pennsylvania, you just get your allocation. It's just a check that is sent to your county commissioners, and they are deciding that. In North Carolina, they are making the requirement that if you want access to be able to be a little bit more creative around the use of your funds, you have to show a specific plan and an indication that you worked with your local stakeholders, and you've had essentially like a coalition meeting formation process at that local level. So Kim, would love to see more of this, and the more that we can advocate for this, I think that that's going to likely increase our impact at the local level and make sure that we have widespread buy-in from communities that really, frankly, can sometimes be underserved. And again, I hear that most of you are from rural locations. I think that the rural locations really need to make sure that they are doing so.
Wonderful. Well, thank you everyone so much. Thank you, Glenn. You really gave us a lot of great information and really next steps, really logical next steps for all of us. And I just wanted to mention one other thing. These are monthly webinars. So we have our next one that Delaware will be doing on July 13th from 12 to 1 about identifying character strengths and engaging in positive communication. I am actually going to put the link if you want to register right now. But really, that is it. Any final words that you want to say to us, Glenn?
No, look, thanks again for having me here. I'm so happy that people are thinking about the use of these funds in productive ways. As I've mentioned before, this is our best opportunity to have an inflection point in the opioid crisis that we have had in the history of trying to address this issue. There's nothing that's been out there to unify us in this important way. And let's make sure that we're sharing information, sharing knowledge, and find ways to make sure that we're maximizing the use of these funds.
Awesome. Thank you. Thank you, everybody. We're a couple minutes over, so I want to be mindful of your time, but hopefully we'll see you next month. All right. Take care.